Embryo culture systems have improved greatly over the past 2 decades. Today, we have the ability to grow embryos to the blastocyst stage, which is typically called a day 5 embryo. And it's during this time that the blastocyst stage when the embryo typically arrives into the uterine cavity, where it then subsequently will implant. By growing embryos to day 5 as opposed to, say, day 3, when they're at the cellular stage, we're better able to select the best embryos. Because on average, about 50% of the embryos will stop growing between day 3 and day 5, so that greatly improves our ability to select them. People often ask me, isn't day 5 better than day 3 when doing an embryo transfer? And of course the answer is yes, but it depends on the individual patient and how many embryos there are to select. If you have a low number or a limited number of embryos, say for example you have only 2 embryos, then it really doesn't matter whether the transfer is done on day 3 or day 5, because you've already picked out the best 2 embryos. If you have lots of embryos, let's say for example on day 3 you've got 5 or more good embryos that we think are good quality, maybe only half of those are good quality, but we just don't have the ability to select those. And in this particular setting, we would allow the embryos to grow 2 more days to the blastocyst stage, and by doing that, we would hopefully be able to better select the best embryos.